I play a decent amount of tennis still for my age, and I've been playing for about 40 years. And it's a great workout, and it's a chance to get a good workout and doing something that you like to do. So from that standpoint, it's a lot of fun, and I've made a lot of friends with tennis, and we do a lot of social things together with the guys I play with. They called me hop along because when I played tennis, that's essentially what I did. I didn't run around. I was hopping because I couldn't extend or I couldn't bend my knees. And that's what I was. I was hop along. When my knees got to their worst level, and when I was really hurting and in a lot of pain, it affected me emotionally, and I got into a lot of depression. And it was to the point where I spent a lot of time by myself because I simply couldn't go out, and a lot of very tough times. You're thinking of the things you want to do and couldn't do, and I literally could not go up and down stairs, and it became, I could do it, but it was a one step at a time process and a lot of pain. And, I can remember someone would call up and want to know if I want to go here or there, or wherever it might be, and the first thing that would come to my mind is, how far am I going to have to walk? I had heard the total knee replacement, of course, is a much more involved surgery, a lot more pain, a lot tougher recovery, a lot more chance of complication. And I had quite a few friends down here that had full knees done, because up until the MAKOplasty came to pass down here, when you had knee problems, that's what you did. And it was scary, very scary, because I knew that I needed both of my knees done. Dr. Biko has a wonderful, wonderful sense of humor, and he said, you got a lot of play in there. He said, but I think we can do probably about a 90% correction and get that much straight. And I was, again, blown away with that. I can remember coming back and telling my friends and people about that, and people would say, nah, no way, it's not going to all happen. I was able to experience a fairly quick recovery. Sometimes I think I'd have to pinch myself to say, you know, you just had this done 3 days ago, and I'm walking around, and the pain was essentially gone. And so, because I can remember, my second knee was scheduled for like 3 weeks after my first one, and it was amazing the lack of apprehension that was there with the experience that I went through with the first one, and it was wonderful. It was just after a 4-month checkup I went in there, and he looked at me and he said, you know, you can start playing in about another week. And I said, what about the right knee? He says, that's ready to go too. So basically, I would say I was playing tennis about 4 months after I had my first knee done. And again, I'm not 25 years old here. So for me, this was just absolutely phenomenal. I was able to play, and since I've been back playing, I have never experienced the first bit of pain from anything I've done playing tennis. And I'm out there playing. I'm playing doubles again on soft courts, and no hard courts and no singles. That was the first things he told me, and of course, I don't do that anyway. My knees feel now like they did 30 years ago, and I don't know how I can get any better than that. With the MAKOplasty, I have not only been able to go out get back and become pain-free. I wish the rest of my body felt as good as my knees do. And I am pain-free, and it has been absolutely wonderful.